Welcome to Crash Cart Nursing, where we help resuscitate your nursing education one topic at a time. I'm Nick McAllister. I'm a registered nurse specializing in emergency medicine and a professor of nursing. Today's episode focuses on the unsung heroes of mental health care, non-pharmacological therapies. These therapies allow our patients to make changes that are beyond the pill. In fact, these treatments often complement or even replace medications entirely, offering them a holistic approach to wellness. So let's jump right in. Imagine a patient with anxiety struggling to get through their daily routine. Medications might help, but non-pharmacological therapies can empower them to manage symptoms independently. These therapies include counseling, stress management, mindfulness, and behavioral approaches, among others. The best part? They often provide long-term benefits that go beyond symptom relief. Here's the thing. These therapies don't just treat the illness, they treat the entire person. And as nurses, we play a critical role in connecting patients with these resources and encouraging them to stay engaged. Remember, mental health care isn't a one-size-fits-all journey. Everybody's got a journey that is completely unique. One of the best things about non-pharmacological therapies is that they put control back into the patient's hands. Medications work at a chemical level, but therapies like cognitive behavioral therapy, or CBT, give patients actionable skills to navigate their day-to-day struggles. So let's take a deeper dive into how these therapies work. Let's start with the classics, psychoanalysis and psychotherapy. Psychoanalysis was developed by Sigmund Freud. It dives deep into the unconscious mind to uncover hidden conflicts. While it's not as commonly practiced today, modern psychotherapy still carries its legacy. The focus is on understanding emotions, behaviors, and patterns to foster growth. Picture a patient who constantly feels guilty but doesn't understand why. Through psychotherapy, they might uncover childhood experiences that shape this emotion. So your role as a nurse? Support them during their sessions by providing reassurances and helping them process what they've learned. A key consideration here is patient commitment. Unlike medication, which can provide biochemical changes relatively quickly, therapy takes time. As nurses, our encouragement and patient education play a big role in their long-term success. I've heard it often said, it works if you work it, meaning it will work if you spend the time doing it. Group and family therapy remind us that mental health care doesn't exist in a vacuum. Group therapy creates a shared space where patients connect with others facing similar challenges, thereby reducing isolation and fostering a sense of belonging. Imagine facilitating care for a patient with depression who feels like no one really understands them. In a group setting, they hear, "I've been there too," and realize that they're not alone in life. That connection can be life-changing. Family therapy, on the other hand, focuses on strengthening support systems. Say you're working with a child diagnosed with ADHD. Family therapy can help parents understand their child's needs, help them to establish routines, and build effective communication strategies. By educating families, you're empowering them to create an environment that promotes healing. In many cases, family dynamics can make or break a patient's progress. Addressing underlying relational conflict, breaking cycles of enabling and improving communication are just as vital as individual therapy sessions. Behavioral and cognitive behavioral therapies, or CBT, are practical, solution-focused approaches. Behavioral therapy targets specific actions using techniques like desensitization or positive reinforcements to encourage change. CBT takes it a step further by addressing thought patterns that drive those behaviors. For example, a patient with social anxiety might learn to challenge negative thoughts like, "everyone will judge me," and replace them with healthier ones like, "I'm doing my best, and that's enough." Over time, these small shifts lead to big changes. So let's talk about how CBT is structured. Unlike traditional talk therapy, CBT is more structured and short-term, with patients often having homework assignments like journaling their thought patterns or practicing new coping mechanisms in real life. As nurses, we can reinforce these techniques in patient interactions, encouraging them to stick with the process. Stress management is another cornerstone of non-pharmacological care. Techniques like deep breathing, progressive muscle relaxation, and mindfulness can significantly reduce anxiety and improve focus. As a quick grounding technique, patients can use anywhere. We ask them to name 5 things that they can see, 4 things that they can touch, 3 things that they can hear, 2 things that they can smell, and 1 thing that they can taste. So this 5, 4, 3, 2, 1 exercise brings patients back to the present moment, reducing overwhelming emotions, encouraging them to use it during high stress situations without prompting from somebody else. One of the things that I like to tell mental health patients that I meet in the emergency department when they say, oh, well, I've tried that. I've tried stress management. I've tried counseling. I've tried cognitive behavioral therapy. It doesn't work. And I remind patients gently that, hey, I get it. There is no magic wand that I can wave to fix all of the mental health problems that you have. But the goal is not to have a magic wand to wave. The goal is to build a effective toolkit of different resources that you can pull out when you find yourself in crisis. So I tell them, I'm like, this stay where you're going and you're going to be hospitalized inpatient is not just about getting medication managed. That's part of it. But the other part is think about what is a new tool that I can establish to put in my tool bag for when I find myself in a stressful situation, for when the weight of the world comes back onto my shoulders. What is that one tool that I learned from this particular event? Maybe if they find themselves in outpatient therapy randomly, what is one tool that they can pull and put into their tool bag for later on for when the stress comes back? It is that acute stress. It is that acute depressive moment that they need to manage. So what tool can I add to my toolkit that's going to help me? Another technique that patients can use is guided imagery. Encouraging patients to visualize a calming scene, such as a beach or a forest, can lower stress and help regulate breathing. As nurses, we can introduce these techniques during moments of distress and remind patients to incorporate them into daily life. Complementary therapies like yoga, art therapy, and animal-assisted therapy also play a vital role in mental health care. These approaches tap into creativity, physical activity, and the human-animal bond to promote healing. Imagine a patient who struggles to express themselves verbally. Through art therapy, they might create a painting that captures their emotions, offering a powerful outlet for self-expression. As a nurse, we should encourage our patients to explore these therapies as a part of their plan of care. Pet therapy has been shown to significantly lower stress and improve mood. Hospitals and psychiatric facilities increasingly incorporate therapy animals into care plans, as simply interacting with a trained therapy dog can release oxytocin and reduce feelings of loneliness. Nonpharmacological therapies are powerful tools that address the mind, body, and soul. As nurses, your encouragement and support can make all the difference in helping patients embrace these approaches. All right, nurses, that wraps up this episode of Crash Cart Nursing. I'm so glad you came. I hope you found today's discussion helpful as you continue your journey in nursing. Remember, every shift is a chance to learn, grow, and make a difference. So stay curious, stay confident, and most importantly, stay compassionate. If you enjoyed this episode, don't forget to subscribe so you never miss a new one. And if you found this helpful, share it with a classmate or a coworker. Let's build this community together. Have a question, a topic request, or just want to share a nursing story? Reach out on any platform you like best. Links are in the bio. I'd love to hear from you. Until next time, keep your crash cart stocked, your caffeine intake high, and your assessments thorough. See you in the next episode.